UK Prime Minister Boris Johnson says he's tested positive for the coronavirus. He is the first world leader to test positive for the virus.
I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough. And on the advice of the chief medical officer, I've taken a test that has come out positive. So I am working from home, I'm self-isolating, and that's entirely the right thing to do, but be in no doubt that I can continue, thanks to the wizardry of modern technology, to communicate with all my top team to lead the national fight back against coronavirus.
All right, our UK correspondent Stuart Smith has more from London. Stuart, that recording was done a while ago. Any updates on the health of Boris Johnson, the Prime Minister?
Well, Boris Johnson, no more updates from him, but we have heard that the Health Secretary has tested positive for COVID-19, as well as Chris Whitty, the Chief Medical Officer in the UK. So it's spreading to quite high levels of government. Michael Gove, the Cabinet Officer, he said in the press conference today that it shows that the virus really can affect anybody. But Boris Johnson and Matt Hancock, the Health Secretary, will be working from home. Their symptoms are only mild, so they will be able to carry on as normal, just from home instead.
And earlier this week, the Prince of Wales also testing positive. Any update on his health at the moment?
No changes for him either. So it's fortunate in a sense that the people that are contracting it at the higher levels of government and people like Prince Charles have only seemed to contracted the milder form of the disease, and obviously they are getting the best healthcare possible. However, it does remain that in terms of testing, it's only those who really need the tests that are getting them, either those who are central to the response of COVID-19 or healthcare workers, but even they are struggling to get enough.
Yeah. And this is a central concern in the UK, isn't it? That the number of cases really is not known because it is so difficult to get those tests.
That's right. We keep hearing figures every day. There's a press conference with the new figures. Today, nearly 15,000 people positive for the virus, but it's only those who are showing symptoms and in hospital who are even being tested. There are probably tens of thousands more in the country, and that also means we won't know for 2 or 3 weeks whether the current London lockdown is even working. There's a big delay period between when the actions are taking place, like here in London where there's a lockdown, and when we get the results as to the spread of the infection.
Yeah, and give us a sense of the number of confirmed cases, the death toll, and how high it possibly could be if we consider those cases that are unknown at the moment.
Yeah, it's increasing incredibly quickly. 800 more cases today, in the over 2,000 now. 2,000 new cases today and nearly 800 dead. We're not sure how far it will go, is the unfortunate answer. The Chief Medical Officer reiterating that. Estimates range to the low millions, unfortunately, which is why the UK is building new hospitals, both in Birmingham, Manchester and here in London at the Excel Centre, which is set to be able to deal with 4,000 new patients, which would up the capacity of London hospitals considerably, but it gives a rather horrible sense of what could be on its way.
Yeah, it sounds like a tube just went by. Stuart, give us a sense of how the lockdown works, because we're experiencing our own here in South Africa. Tell us what the rules are in London, what you're allowed to do, what you're not allowed to do.
That's right. Key workers are certainly allowed to travel. That includes frontline workers like NHS staff, and the trains and the buses are all still running to allow these key workers to get into work. Rather controversially, it's not just key workers who are allowed to travel. The advice remains that if you cannot do your job from home, you are still allowed to travel to that job, and that includes builders and the construction industry, many of whom are freelancers, cannot afford to take time off work. They will not be paid if they take time off work, and there's been a big controversy about whether they should be working at all.
Yeah. And finally, Stuart, I mean, how is the political response to this being received, if you can speak in sort of general terms? Criticism about the testing not being widespread, but do you believe that UK citizens believe the government's doing a good job at the moment?
Certainly at the beginning, the government was widely praised for its seemingly very quick response. There is certainly a lot more questions now being asked about whether the response was quick enough originally, whether there was enough funding given to people like freelancers originally, because they still had to commute into work. There is certainly a lot of anxiety now about whether the government truly can keep people safe in the UK. There were never any promises made at the beginning, but certainly a lot of questions being asked now.
All right, thank you very much. SABC News correspondent Stuart Smith reporting live from London.